Hello, everyone, and welcome to February 2016's Telehealth. I am Emily from the Parkinsons Resource Center in Spokane. And today's speaker is Sabrina Gonder, and the topic is sleep hygiene. Sabrina wants to live in a world where people are healthy, happy, and vibrant. As a board-certified health coach and corporate wellness specialist, she works with clients both one-on-one and in small groups. She's taught workshops on sugar addiction, and I'm going to say this wrong, kombucha, fermented foods, avoiding chemicals, digestive health, and more. When she's not spending time with her family, you can find her organizing community functions that promote wellness, walking the Centennial Trail, or gardening. And here's Sabrina.
Thank you. I'm not sure if I've got this portable one going right or not. So it's little red light. I'm good? Okay. Can you hear me now? If I walk away? Yes?
Yes.
In the back? All right. Awesome. Well, thank you for having me. This is the third time I've been able to present at the telehealth, and 3 is my favorite number. So I'm excited to be here. And what a beautiful day. Is it not gorgeous out today? I have never seen this parking lot so full, and so I was really grateful that we didn't have snow on the ground because I had to hike in about 3 blocks. So it's really a beautiful day. So today I'm going to talk to you about sleep hygiene. And when I shared with people that I was going to talk on sleep hygiene, the reaction I got was, and so I want to tell you what sleep hygiene is. How many of you struggle with sleep? Okay, it's really, really common, especially among those with Parkinsons. I'm finding in my practice that a lot of my clients without Parkinson's struggle with it as well. So sleep hygiene are habits and practices that are conducive to sleeping on a regular basis. And don't we all want that? I certainly do, and I want that for you as well. So why is sleep so important to your health? We're going to look at that today. So how much sleep do you really need? How many think you need 5 hours of sleep? How about 6? 7? Good. 8? And 9? Okay. Most people need between 7 and 9 hours of sleep a night. How many of you are getting that? 1, 2, maybe? Okay. Good. Well, I'm going to share with you some tips and tricks to hopefully get you towards that 7 to 9 range. And it does vary for people. So I happen to be a person who really likes to sleep. I always have. I was a child that would come home from school and take a nap almost every day. I would go to school, and when I had my first job, take a nap and then go to work. I just have always required a lot of sleep. So I really empathize with those that aren't getting enough sleep because it's so important. In fact, just yesterday I took a nap. And I'll talk to you about that a little bit too, how long that nap should be. So an ongoing sleep deficit is linked to increased heart disease, kidney disease, high blood pressure, diabetes, and stroke. So it's really, really important that we get enough sleep. So I want to ask you, why aren't you sleeping? Some of the common reasons are caffeine too close to bedtime. So I know it's just after 2 o'clock, but for some of you, you really shouldn't have any caffeine after this hour. And that's very dependent on your person. Screen time. And Beth is here. She's a future Institute for Integrative Nutrition health coach. She's a nurse by trade, and she's in the program right now. And we were talking about the fact that she just got all screens out of her bedroom. So a screen can be a TV, it can be an iPad, a laptop, a cell phone. And so my generation and younger, I know for sure, almost always has a cell phone charging next to their bed. And it's really important that we get these screens out of our bedroom and not viewing them, and this includes TV, 1 hour before bedtime. Sleeping with pets. How many of you have pets? Handful of you, okay. So a lot of my friends that have pets allow the pets to sleep on the bed with them. That sounds really sweet, but it can be very disruptive to your sleep. So it's really better to have them in their own little area that's off of your bed and maybe even in another room of the house. Having a nightcap. I know some of my family members were in the habit of having a little nightcap before they would go to bed. And so that might have helped them to get to sleep, but generally they would wake up 2 to 3 hours after falling asleep. So having a nightcap can affect your sleep overall. And electricity. I'm going to talk a little bit more about that in a minute. So I just thought this was a cute image of this cat asleep on the computer. And I have done this before, not on top of my computer so much, but having it next to the bed before I remove screens from my bedroom. So this is more and more common with whether it be a cell phone or a laptop or some other electronic device. Now we have Kindles and there's just so many. I think I have 5 devices at home that are some different brand. I have an iPad and I have a Kindle and I have a cell phone, I have a laptop. So I just have all these electronics that are scattered all over, and so getting those out of the bedroom is a really good thing to do. So these are a lot of the reasons that people aren't sleeping, and we're going to touch on some of them. There can be a medical condition for sure. So if you're chronically not sleeping, I really recommend that you mention that to your physician and see if there's something medically that's going on. But a lot of people that are quote unquote healthy just are not sleeping well at all. So I want to talk about sleep myths. There are a lot of myths out there about sleep, and I want to dispel those for you. And some of these are probably really familiar to you. The first one is sleep is a time when your body shuts down for rest and relaxation. This is a myth. There's no evidence that this is true. Some physiological processes actually become more active while you sleep. I have some of my best ideas when I'm in a light state of sleep. Sometimes I'll remember things when I'm just in that waking period of time. So keep that in mind. The second myth is getting just 1 hour less of sleep per night than is needed, say 6 hours, that won't affect you. Well, that's a myth. Slightly less sleep can affect your ability to think properly and respond quickly. It can improve your cardiovascular health, impair your cardiovascular health and energy balance, as well as your body's ability to fight infections. I thought that was very interesting. If you consistently don't get enough sleep, a sleep debt builds up that you can never repay. So I know a lot of people say, oh, well, I'll just catch up on my sleep on the weekend. It sounds really good, but that's really not accurate. Your body just can't do that. Another myth is that your body quickly adjusts to different sleep schedules. Have any of you ever worked a rotating shift where it changed from one shift to the next? Well, as a spouse of a shift worker, I can tell you I worked that shift too. So for 26 and a half years, my husband rotated his shift at work every single week. And it went from days to swing to graveyard. And there have been studies shown that takes years off of a person's life. This is February? Pardon? Now I tell you, yeah. There are things you can do about it. The best thing is to get off that shift for sure. So we were blessed about 7 months ago. My husband got a straight day shift. And I can tell you it was almost immediate that I could see a change in his health. He was able to sleep for 7 hours where before it was 4. He would sleep about 4 hours max. He was tired all the time. His diet and digestion were not good. And he just was really, really low energy. So you really need to be in a pattern. People need less sleep as they get older. That's another myth. And I'm not sure where that came from, but it's not true. We need 7 to 9 hours of sleep. As we age, we don't need less sleep. Well, we might get less sleep and find it less refreshing. And that's because as we age, the quality of our sleep changes. So think about that, quality versus quantity. Older people are also more likely to have insomnia or other medical conditions that disrupt their sleep. So I thought that was really interesting. I don't know how many of you know about these fun new devices. This is a Fitbit. And what I like about the Fitbit is I can look in my phone and actually see what kind of quality sleep I got and how long I slept. So it's really interesting from that standpoint alone to see. I know for me, Saturday night, I did not get enough sleep, nor did I get quality sleep. So I was able to look at that, and that helps me to adjust, either get to sleep a little bit earlier or sleep in a little bit longer the next day. The next myth is that extra sleep for just one night can cure you of problems with excessive daytime fatigue. Not only is the quantity of sleep important, but also the quality. And some people, they need 8 or 9 hours. They get 8 or 9 hours of sleep, but they don't feel rested when they wake up. And I know for years that was the case for me. So really getting quality sleep along with that quantity is important. The next myth is that naps are a waste of time. How many nappers do I have here? All right, love it. I love it. I'm a firm believer in naps. The trick with naps is to not take them after 3 o'clock in the afternoon and not to take them for more than about 20 minutes. Because if we sleep longer than that 20-minute time frame, then we're usually pretty groggy and we often can't get to sleep that night. So try that out. Sometimes I know just sitting quietly and closing my eyes will refresh me enough to keep on going. I love naps. I think we should have nap time at work. They have nap pods. I don't know if you've ever heard of them or seen them, but Google has them at their corporate office. And it's like this dome unit that you lay down in, and you can lay in there and take a power nap during your lunchtime. I just think that's a great idea. The next myth is that snoring is a normal part of sleep. Snoring during sleep is common, particularly as a person gets older. So the myth is that, as we age, we just snore. It's actually a myth. Evidence is growing that snoring on a regular basis can make you sleepy. During the day, it can increase your risk of diabetes and heart disease. There's those two words again. Some studies link frequent snoring to problem behavior and poor school achievement in children. So see if your kids or grandkids are snoring. That's really interesting. Loud, frequent snoring also can be a sign of sleep apnea. So sleep apnea is where you kind of stop breathing during the middle of the night, and you can have that snoring kind of gurgling sounds. And it's pretty common, and there's more and more devices out there. Now they've got just a tiny little one that fits into your nasal cavity area that isn't this great big CPAP machine. So they've come a long way with helping folks with sleep apnea. The next myth is that the main cause of insomnia is worry. How many of you don't sleep when you're worried about a kid, a grandkid, a friend, a family member? Okay. And I'm going to give you some tips for that too. Worry or stress can cause a short-term insomnia, but certain medications and sleep disorders can keep you up at night. Other common causes, so keep this in mind, can be depression, anxiety, asthma, arthritis, or other medical conditions. It's not normal or healthy to not sleep and have insomnia for a long period of time. Does that make sense? Okay. So those are the myths, and now I want to talk about the number one sleep disruptor, and that's electricity. So how many of you ever have thought about it like this? I know I had not. So all these items require electricity. And if you think back to November 17th, during our lovely windstorm, how many of you lost power? Almost all of you. Okay. We did at our house, and not that long, so don't hate me for having power after 2.5 days. But what I discovered is that very first night, I did not know what to do with myself because I couldn't cook, I couldn't do laundry, I couldn't read very well. I tried for a little while, but my husband was just laughing at me saying, "Honey, you don't know what to do with yourself." I spend a lot of time at the computer doing research. Couldn't do that. So finally about 6 o'clock, I said, "I'm going to bed. There's nothing else to do." Well, I remember waking up and my husband said, and everything was out. My cell phone was out. Of course, I didn't have an alarm clock, anything like that. He had a little bit of juice left on his phone for his alarm for work the next morning, thank goodness. And we both woke up, and he goes, "Guess what time it is?" And I go, 3:30? I was hoping, because we get up at 4:30. He said, "It's 11:30. I thought, really? It felt like the longest night. But before we had all of this, midnight was the middle of the night. So when it got dark, we went to bed. When it got light, we got up. And that makes so much sense to me. We don't live that way anymore. Often people are going to bed around midnight, catching the evening news, watching a program, whatever the case may be. And so then there's no way we're going to get up at 3 or 4 o'clock in the morning consistently. So I just really thought that was powerful to have experienced that storm and how it was for me and how I responded to it with my sleep and with the lack of what to do without power. We also, most of us, prescribe to the Standard American Diet, or SAD is the acronym for it. And so we're eating in a way that's not conducive for us to sleep very well. And we have a lowered physical activity and increased stress. All of those are factors in sleep or lack thereof. And stress is something I spoke on last time I was here. So if you have the opportunity, I encourage you to watch the replay. Stress is a part of our life, and we don't ever want that to go away, but we want to manage the stress. So now I have some good news for you. How to get more sleep. We all want that, right? So, how many of you are successful at going to bed at the same time every day? Good, awesome. A good handful of you. That's really important. And I know I do really well during the work week, but the weekends can derail me a little bit. So again, that 7 to 9 hour goal every night will help you get better quality sleep. Avoiding caffeine in the afternoon or evening. Again, this is dependent on your body. Every body is different, but caffeine has a 6 to 9 hour half-life, which means that caffeine can be affecting you for 6 to 9 hours after you've consumed it. So keep that in mind. The screens, I can't emphasize the screens enough. And I think for a lot of us, the TV is the biggest screen that we're interacting with prior to going to bed. And I know growing up, we watched the 11 o'clock news, then we went to bed. Well, most of the news is negative, wouldn't you agree? Most of the stories are negative. Every once in a while, they throw a little positive one in there. So those stories are replaying in our mind when we're trying to sleep. So if you can wean yourself from the screens, whether it's a cell phone or a laptop or a TV, an hour before going to bed, you should find that you'll have better quality sleep. Exercising too close to bedtime, and this is, again, very, very individual. So some people can exercise an hour prior to going to bed, and some people, they need to do it much earlier than that, maybe 4 or 5 o'clock. That can disrupt your sleep. Trying to drink chamomile tea before bedtime. That can be a really relaxing way. It's warm, it's soothing, it's decaffeinated. So that's an option for you too. When we were talking about the insomnia and the stress earlier, I like to teach my clients a technique called a brain dump. So if you are laying in bed, kind of like this, and you cannot sleep and you've got all these thoughts and feelings and emotions going through your head, I recommend you get a piece of paper, and I just keep this on my nightstand every night, and I have a pen or pencil, it doesn't matter, and I write down every thought that's coming to my mind. We're not checking for spelling or punctuation or grammar. It's supposed to be just as quick as you have that thought, you write that down. And if you do that over time, you should find that you're able to just kind of put those thoughts on a shelf. They don't go away. They just get shelved where you can relax and go to sleep. Essential oils. How many of you use essential oils? A couple of you? Okay. So lavender is a very powerful essential oil. And essential oils are either a flower or a leaf that has been pressed down into a liquid form. And what I like about lavender is it helps you sleep. It promotes relaxation and sleep. So when my husband was working those lovely shifts and couldn't sleep, I would rub it on the bottom of his feet and it would help him to fall asleep. The reason the feet is that your pores on your feet are larger. And remember, our skin is our largest organ. So that oil would get absorbed into his body that way and it would help him to fall asleep. You also can put lavender, a few drops in a bathtub of water, and that can be very relaxing. For some people, that's their evening ritual, to soak in a tub, and you can put lavender there. And also you can put it in a spray bottle and spray your sheets with it a little bit. My favorite way is to put it topically on the bottom of feet. The next one was one I really fought because I tend to be cold all the time. So our bedroom should be a little bit cooler than the rest of our house. And so for some of you, that means cracking a window, as long as you don't get too cold and you're not having traffic noises and that type of thing. But once I gave in and allowed that to happen, my husband was so grateful, number one. But I found that I did sleep better. So keeping your bedroom a little bit cooler than the rest of your house is really helpful for sleep. Getting outside during the day as much as possible. So a day like this is a perfect example. It's not too cold, it's not too hot, it's pretty much just right. Just that little bit of sunshine and fresh air can really make a difference in your sleep that evening. The next one is a technique, and I've demonstrated this before, and I'll be happy to do it again, but it's called the 4-7-8 breathing technique. And what I love, do you do it? Do you practice it? Oh, and so tell me what it's done for you.
It clears my mind. I don't think of anything else. I'm just thinking about the numbers.
Okay.
You know? And
Yes.
And all of a sudden, I'm done. I'm relaxed. Sometimes I fall asleep.
Excellent.
While I'm doing it. No, it's great.
Oh, I'm so glad to hear that. So I've shared it with a lot of people. Those that practice it find benefit with it. So would you like me to demonstrate that for you? Okay. So if you like to go on the computer and if you like to Google anything, you can Google Dr. Andrew Weil, W-E-I-L, and it's his breathing technique. And what it is you breathe in for 4 counts and hold it through your nose. You're going to breathe in through your nose. You hold it for 7 and you release it for 8. And the trick with the release is to put your tongue up behind your front 2 teeth. So I'll look goofy, but I'll do it for you, okay? So I'm going to do this for the counting because I can't do it and talk to you at the same time. Okay, so. It's that simple. You do it over and over again, and it can help you to fall asleep, especially if you tend to wake up during the middle of the night. I also do it if I feel like I'm getting a little bit stressed out. I won't do it for a prolonged period because I don't want to fall asleep, like driving or standing in line or something like that. But I found myself in some little bit tense situations at times, and I will incorporate that breathing technique, and it puts your body in that parasympathetic state, and it works. So I'm really glad to hear that you use that technique. I can definitely get you the link or get you more information or practice with you afterwards if you're interested in that. It's really, really powerful. And it falls in line with the last technique that I want to share with you, and that's meditation. And I think when people hear the word meditation, they have different ideas of what that is. So meditation can be something as simple as closing your eyes and thinking about one thing. It could be breathing. That breathing technique is really a form of meditation. It can be praying. It can be just being still and silent, because we live in a really busy, loud world. So I really believe in meditation. I know you can do it as quick as 1 minute, or you can do it for hours. And it does take practice. It's similar to the 4-7-8 breathing technique. You have to do it over and over, just like anything else, for it to become a habit. Super powerful and just really, really helpful with getting your body in that parasympathetic state so you can fall asleep. So my encouragement for you is to make sleep a priority, and you will see the world differently, and it'll affect your mind, body, and your spirit. Thank you. Can I just have this?
Yes.
Okay. And I have a handout for all of you. I didn't give it to you earlier because I wanted you to hear what I had to say. And it's a little sleep diary. So my encouragement for you is either grab another piece of paper and use this and track it for at least a week, or make copies if you have access to that. What I've found with my clients that do this is we've found a way to either get them to bed a little bit earlier, or we've found some medication that's been an issue, or we've incorporated some relaxation techniques. So this can be a really helpful tool for you to see maybe why you're not sleeping, or why you're not sleeping well, or getting that quality sleep.
Very good. Okay, so now we're going to do question and answer. And so please mute your mics until I call your city, and then Sabrina will be able to answer any questions you have. And go ahead and tell me how many people are at the site also, please. So let's start with Anchorage, Alaska.
Hello.
Hello.
We have three people. We have 3 people here. One question.
Okay.
That is recommendations for the active dreaming that Parkinson's people have to deal with active dreaming. Assuming we act out our dreams.
Not specifically, no. I haven't really dealt with that. I definitely think that's probably more of a medical condition. But I think the breathing for anybody and everybody's situation could be possible. But if they're doing it and they're not conscious, that's a little out of my scope.
Okay, thank you.
Thank you, Anchorage.
You're welcome.
And then, what was it, Pam?
I didn't understand
The question?
Yeah, acting out in their dreams.
Oh,
Yeah.
dreams.
Yeah.
Okay, and then I'll try and repeat the question too. It's a little hard for us to hear. So let's go to Clarkston at Tri-State Memorial Hospital. Are you there? And I don't know which one they are, but let's go to Coeur d'Alene.
We have 8 people and we have 1 question.
Okay.
One question and one comment.
Oh, and a comment.
Okay. Go ahead.
You showed a breathing, she showed a 4, I think 7, 8 breathing technique. Could you show that again? And how soon before you actually hit the bed, go to sleep, do you do it? Do you do it when you're in bed? Do you do it when you're getting ready for bed? What?
Great question. Can you hear me?
Yes.
Okay, great question. So I do it when I'm first getting into bed. And I also do it if I wake up in the middle of the night and I want to get back to sleep. So anytime you want to go to bed. Does that make sense?
Yes.
Okay, and then you want me to demonstrate it again? Okay,
Yes.
so the tricky part is I can't talk and do the breathing at the same time. So when I do this, that's how long I'm holding the breath. So the first is I'm going to breathe in through my nose for the count of 4. And then I'm going to hold it for the count of 7. And I'm going to breathe out for the count of 8. And it's a yogic technique to put your tongue behind your front 2 teeth. And it does It does make a difference. That is important, which is kind of hard to convey in the video, but let me do it for you. Is that helpful?
Yes, thank you.
Okay, great.
One of the things that I found with the active dreaming is that if I take melatonin, and I think it's 3 milligrams right now, before I go to bed, I don't do that as much or at all.
That's great. And I think that should be under the guide of a physician or someone to get the right amount for you. Melatonin's natural and a great sleep aid.
Thank you,
Doctor
Gonder.
told him to do that. His doctor told him to do that in 3 to 10 milligrams, but starting with 3.
Starting with 3 to 10 milligrams of melatonin before bed.
Yes.
Okay, thank you guys very much. Let's go to Kalispell, Montana. Is Kalispell still there? I see you guys. Can't hear you yet. Oh, there we go.
Kalispell.
Now.
Now?
Now you can hear us.
Yes.
There are 8 of us.
8, okay. Is there any questions?
I don't think any questions.
No questions? Okay, thank you guys.
They're all asleep.
Looks like it worked. Okay, let's go to Miles City.
This is Miles City. We have no questions.
Okay, how many people are there?
9.
9. Okay, thank you. Thank you, guys. Let's go to Moses Lake.
Thank you for the program. We have 19 in attendance here today. We have a few questions. I'll ask the first one. The Dr. Wheel, is more description than sort of first name, sort of a more helps to find that on Google?
Absolutely. Dr. Andrew Weil, and it's W-E-I-L. And then if you put Dr. Andrew Weil breathing techniques, that should come right up.
Okay. The other question I had before I open it to the others, you didn't say anything about what kind of bed we should have.
I didn't,
no. Is that for good reason?
No, not necessarily. So most people should replace their bed every 8 years. So think about that. That's always a good place to start. And there's so many different types. I think that it's really important. And nowadays you can go kind of test drive a bed, if you will, and get one that's best suited for your body. But latex is supposed to be the best mattress for you.
Latex?
Mm-hmm.
Latex in terms of the mattress.
Yes.
Biggest problem I've always had is their beds are too short.
I don't have that problem.
Well, I'm 5'17", so I have a problem with that.
I bet that is a challenge.
Sandy, you had a question? Yes, would you mind giving a verbal description or definition of sleep apnea?
Wow, okay. I don't know the exact definition, but what I've experienced with people or know of people that have it is that it's actually they aren't breathing for a period of time. So sometimes there's kind of that choking or that it's different from a snoring sound. It's almost like they're trying to catch their breath after holding their breath, if you will, during sleep.
Diana, did you have a question?
I have a question, please. If the TV is in your bedroom, is it possible to just cover it up with a blanket? or do you actually have to remove it from the bedroom?
It's really more about having it on. There's a flicker rate from devices, a TV included. So if it's off, it shouldn't be a problem for you. I had that battle at my house.
Question? Go ahead.
I have a question. Is it true that our bodies produce melatonin only in the dark? So we need light to be removed?
So the question is it true that we only produce melatonin at night?
Or in the dark?
In the dark?
Darkness.
You know, I
Like
don't really,
you need all your lights off.
I don't know the answer to that. I could find out, certainly. Do you know, Beth? So light breaks down, this is our nurse in the audience, light breaks down melatonin. So a lot of people are low in melatonin. Again, that's something that I recommend you get checked for the dose, and not everybody does well with melatonin. So getting outside is good, and again, getting enough sleep and quality sleep is really important.
Thank you.
I have a question. When you sleep for 2 hours and you wake up, what causes that, and is that insomnia? What do we and then having trouble to get back to sleep?
Got to go to the bathroom.
Sometimes.
That happens a lot, and not knowing your particular case, I couldn't speak to that. A lot of the things that I talked about can cause that, such as screen time, if you are having alcohol right before bed, if you're exercising too close to bed, if you're stressed. But that breathing technique should help you get back to sleep, because I know a lot of people are waking up throughout the night, more and more that I talk to. So try that breathing technique and see if that doesn't help you get back to sleep.
Thank you.
Uh-huh.
Thank you, Moses Lake. Is there any other questions there?
Thank you.
Thank you. Let's move on to Port Townsend. Are you guys still there? Port Townsend. Okay, I think they're sleeping. They tried the technique too many times. Okay, let's go to Pullman.
There are 6 of us here in Pullman, and there's a question.
Okay.
From me. When I take my Parkinson's medications, I go to sleep. Are there any breathing techniques that would help me get over this problem? I've been on the medications for many years, and it hasn't gotten any better. Every time I take a dose, I go to sleep.
To not go to sleep, then, is your question.
Yes. Are there breathing techniques that I can use after taking my Parkinson's medications that will keep me awake?
That's a good question. I know there are energetic breathing techniques, but I don't personally know what those are. I could definitely look into that for you. Another essential oil that could help you is a peppermint oil. Since I was talking about essential oils earlier, peppermint can rejuvenate and give you energy. So possibly trying that, but I will look into that for you.
Thank you.
Can you make a note of that for me? Yes.
Okay, is there any more questions in Pullman?
No, not now. Thank you.
Okay, thank you. Let's go to Richland.
Hi there. There's 7 of us today.
Okay. Hi. You guys have any questions? No questions?
No.
Okay. Thank you. And then let's go to Tenasket.
Hi, there's 3 of us today, and there's no questions.
No questions. And then last on the list, except Spokane, let's go to Walla Walla.
There are 2
And we have no,
2 people and no questions?
yeah, nice present.
Okay, thank you so much for tuning in. And then let's go to Spokane. In Spokane, do we have any questions? Pam? Okay.
Hold on just a second.
And then we probably should repeat the question if they can't. I don't know if they
Okay,
can.
I wake up easily through the night to go to where, the bathroom. Okay. Usually I go to the kitchen, get something to eat, or I go and clean the dishes, and then I go back and I go back to sleep. What's the question there? I don't know what it is.
A lot of times, doctors and things will tell you to get up and do something so that you're active, so you can go back to bed, use that energy. But maybe you want to know how to stop so many of those wake-up periods? Is that kind of what you're thinking of? Okay. Don't let me put words in your mouth, because I will. I'm good at it. Okay.
Sure. Okay. Well, so when you get up and do activities, that does, of course, stimulate you more. So if you're going to get up, you should do something really, really boring, or read a book that not that you don't like, but that you've read that same paragraph over and over and over again. That can help you to go back to sleep. But the frequency of your waking up. So I would examine what you're doing up, 6 hours before you go to bed. Are you drinking a cup of coffee? Are you in front of the TV, an hour before bed? Look at all those things that can be triggering those wake-ups throughout the night. Does that make sense? Okay. And then try that breathing technique, Pam. I think that will really help you.
Can you hear us in Sandpoint?
Yes, we can.
Oh, great. We have 11 here.
Oh, sorry, I missed you. You weren't checked off. I'm sorry, Sandpoint. Do you have any questions?
I have one. You mentioned screens to be eliminated out of the bedroom. What about nightlights that are clear across the room?
Nightlight.
You might experiment with that. I think they're kind of handy for not tripping when you do get up in the middle of the night. But if that's enough light to bother you, it's really more of the flickering light that you get from an actual screen. So that would be a TV, a laptop, a cell phone. So the night light really shouldn't be disrupting your sleep.
Okay.
What about a clock radio?
Oh, I'm so glad you mentioned that. Okay, so if you're one that wakes up and looks at the clock and thinks, like I did during the storm, oh my goodness, it's only 11:30, turn your clock around so that the time is facing the wall, because that's a clock watcher. And that stress of knowing what time it is can really affect your sleep, especially for those of us that are punching a clock. It does definitely affect your sleep. So I tell people, you don't have to take it out of your room, but turn it around so you're not looking at it all the time.
Thank you, Sandpoint. Is there any more questions?
No, thank you.
Okay, thank you, guys. Sorry I missed you. Any more from Spokane?
Just blame it on me. You caught it from me.
I know.
I do that all the time.
Allergies, I'm sniffling. Sorry.
No, I mean skipping people. I did it all the time. So we don't have a question. We have a comment here in Spokane. But if you have a question, still we have time.
Well, I find that I can fall asleep better with the TV on than laying in a dark room, and I'm just like wide awake. But if I'm hearing somebody talking, I close my eyes when the TV's on, but if I hear someone talking, then that relaxes me and puts me to sleep. But if it's dead quiet and dark in the room.
Are you open for a suggestion?
Sure.
Okay, the radio or a sound machine would be better for you.
Yeah, so you use a nature app on an iPad?
I don't think it does much. The last 3 months, I have had chronic insomnia, and I can't sleep without sleep medication now.
Okay.
If I don't take any, it'll be 4 or 5 o'clock in the morning before I fall asleep, and then I sleep maybe for 2 hours, and it's not restful sleep.
They want to hear what you're saying.
So chronic insomnia, you said? You're taking sleep medication?
Oh, I have to. And,
Okay.
and I take one for 10 days and it wears off, and I have to go to switch to something else for 10 days, and it's just a cycle. It's
Unfortunately, that's often what happens with medication, and sometimes it's really, really necessary. But if you want to try to work your way through that, try some of these techniques.
This just started at the beginning of November.
Okay.
And it's just a vicious cycle. I got some anxiety and that just, I don't know. I just feel like I'm in a vicious cycle now.
It does.
Well, so some of the techniques that Sabrina talked today are new ones that maybe hopefully they work longer than 10 days, but you can push them in.
I've tried just about everything for insomnia, and I need some strong medications for sleep.
Well, and Sabrina is available for other services besides talking to us. She's so great to talk, just like all of our other speakers, but she also has her health coach that you can talk to her and see if she can find some other solutions to help you out with.
Sure, and I can talk to you after this too.
I have just also started getting high blood pressure the last 3 months as well.
Okay. You've got a series of things going on. Okay. Let's chat.
Were there any other questions? Yes?
What about waking up in the middle of the night and you're kind of disorientated where you're going or you're not sure? Is there a way should you sit, relax a little bit before you get up and start walking around, or is there something that you need to be aware of?
Yeah, well is that on a nightly basis?
It happens periodically.
Okay, well one thing that humans don't do that all animals do, and now you're going to watch your pets for this, when animals first wake up, they stretch. We don't typically do that. We hit the ground running. So laying there and stretching a little bit and get oriented to the room and where you're at is a really good thing to get in the habit of doing.
Okay, great. Thank you.
You're welcome.
We had one additional question from Moses Lake.
Okay, go ahead, Moses Lake.
This has been very interesting, but I've never heard of a health coach before, and I'm curious about your education, what you have to do to be a health coach.
Great, thank you. Yes, I usually start with that because even though the school I attended is 25 years old, very few people know what we do, and we're getting more mainstream, and a lot of doctors and naturopaths are using our services. So what I do is I educate and support people around nutrition and lifestyle choices. And I have my own practice, and then I also do corporate wellness. So I actually work out at Kaiser Aluminum with those poor folks who are shift working for most of their days. So the school I attended is the Institute for Integrative Nutrition, or IIN for short. It was founded by Joshua Rosenthal, and it was just the best decision that I made as a career goes. I love what I do.
Thank you, Moses Lake. Okay, let's go back to Spokane.
I just had a short comment about the lady talking about needing a TV or something going to sleep. I find if I turn that door, I can just barely hear, really can't make out. My mind starts listening and trying to hear, and I go right to sleep. And that's not a real problem for me because I can go to sleep in the middle of a sneeze. But if I have that, instead of really listening to it, just where it's kind of a mumble, you're kind of halfway hearing it and not hearing it.
Yeah, it
Seems
reminds
to put you to sleep quicker.
Okay, yeah, it reminds me of when back in the day when TV actually turned off for the night and you didn't have any more programs to watch. Yeah, and you'd have the white noise. Yeah, just something there. My only caution is that it's a screen, so you've got a flicker rate that truly will affect your sleep. So again, I recommend a radio down low or a sound device or something like that. I'm trying to give you some other tools in your toolkit for sleep.
Okay, thank you. Is there any more questions for Spokane or any other place that I might have missed on accident? Sorry. Okay, thank you. Thank you, Sabrina. And next month's telehealth will be on the Duopa program. Yeah, go ahead. I just brought these two things up. But
No, you had it absolutely right.
Okay.
It's we're next month. We are lucky to have Dr. Aldred and Dr. Ken Symington from Holy Family Hospital and their team that works with the PD patients that now are going to switch over to the Duopa pump delivery system, which is the 16-hour-a-day delivery system that's actually kind of like a diabetic pump. I think there's going to be 5 of them, the whole team that's here that works with everybody. So it's going to be interesting. We'll learn a lot about the Duopa pump and that delivery system. And did you tell them about Paint for the Heart with Parkinsons?
Not yet.
19th, right?
Yes.
19th of February. You can come on your own or with somebody. Emily is going to be leading a Paint with Your Heart for Parkinsons, a little fundraiser that we haven't done yet, but painting and a little wine and cheese, and all the proceeds go to programs like this. And then we received today, you're not going to be able to see this, but we received a great big box of brochures for the World Parkinson's Congress in Portland. So we have a whole bunch of the brochures, but you can also go to their website online. If you type in World Parkinson's Congress Portland, it'll come right up. But the website is WPC2016.org. And I just stole Emily's show, and she did such a good job. We got to tell Emily thank you.
No, thanks. Thank you. And if there's any questions, you can go ahead and call us at the PRC or just email us at center@SpokaneParkinsons.org. And thank you, guys.